Good morning, everybody. Happy Friday morning. For anyone that hasn't met me, my name is Zheng. I'm one of the first-year nephrology fellows. Today, I'm going to be talking about artificial intelligence in medicine and its implications in nephrology. I want to start with saying I don't have any disclosures. I'm not connected to big AI in any way, shape, or form, nor am I an expert in AI. I just hold an interest in it. In terms of our talk today, I'm going to define the definition of AI, talk briefly about the history of AI, discuss some applications of AI in medicine, some of the research that's being done with a focus in nephrology. I'm going to talk about the challenges of implementing AI. So these pictures, do they seem familiar to us? And what do they all have in common? Well, these are all AI generated pictures that was used for Neph Madness. So all of us should remember something about them. But just to show that how far AI has come in creating some things. The term AI, so this is the definition of what artificial intelligence is a machine-based system that can, for a given set of human-defined objectives, make predictions, recommendations, or decisions influencing real or virtual environments. A lot of words. To summarize, basically AI is a machine that does what humans can do autonomously. I think for a lot of us, AI, we think of something that's pretty recent, especially with the new attention on it with the release of ChatGPT. But I just want to focus on the fact that it has been around for a while and things have been getting done for a while. You could see on this timeline, at first in the 1950s, people started thinking about AI. In the 1990s, the AI beat a chess champion. In 2011, it won Jeopardy, and all the way to 2022 with the release of ChatGPT into the general public. And that's when the general perception of it really started to pick up. Why is AI so important? I think it's become a point where it's infiltrating all parts of our lives. Outside of medicine, I'm sure most of us have a smartphone. The Siri or whatever virtual assistant you have is a form of AI. Our navigation systems, language translators, autonomous driving, these all use AI in some way, shape, or form. And it's becoming really prevalent in the general public. And as well as now in medicine, it is starting to creep into things we do as well. In terms of chatbots, there's virtual assistants and devices and starting to make its way into some imaging things as well. So very prevalent and people are starting to see it everywhere. A little bit about the terminologies used in AI. So AI itself is this big encompassing box. And within AI, there's a subgroup called machine learning. Machine learning is basically AI that uses data and algorithms to train computers to make classifications, generate predictions, and uncover trends. Machine learning is where a decent amount of medical research is being done in AI, so that's why I wanted to talk about this. Within a deeper subset of machine learning, there's something called deep learning, which is a type of machine learning that's based off of these artificial neural networks, which are used to extract progressively higher levels of features from data. Why I wanted to touch on this is deep learning is where a lot of the generative AI products come from, so I just wanted to define the term. So AI right now in medicine, there's been a lot of different tools that's been made based off of its technology. Often these tools are created to improve efficiency for physicians, and a lot of them are already released and being used by physicians right now. For example, these AI scribes are tools that some organizations are using, in which you leave your smartphone or some sort of recording device when you're talking to a patient. Of course, should be HIPAA compliant and data secure. But then after it picks up on what you and your patients talk about and generates a note for you directly into the electronic medical record system. Another thing I found is Visual DX, in which you take a picture of a skin lesion, the AI analyzes it, and it's able to spit out differential diagnoses for you. Not saying this should replace dermatologists, but could help us aid in triage things. Something that I've used a fair amount is the Doximity GPT, which we all have access to, in which you are able to ask it a prompt and it will respond with different things. In this picture here, it writes an HPI for you, but I've used it to help me template prior auth denials and help me write appeal letters. I've used this a couple of times. Another common tool that we've been using is something called Open Evidence. It's like a chat bot, sort of like ChatGPT, but instead it searches through PubMed and gives you answers. It actually, I think recently just had a partnership with New England Journal of Medicine as well. But this is just an example. I asked it, how do I treat IgA nephropathy? I'm not going to go through all of this, but it spits out some general recommendations. That's pretty accurate, and it cites them as well. So you can go to the article to see where it drew the evidence. And if you're unsatisfied with the answer, you can look up something more specific. Like for example, here, I've tried all these things, nothing's worked. So what can I do? And it'll tell me what else it's thinking about, like iptacopan or sparsentan and other things. So beyond that, what is happening at UW Medicine in terms of AI? So our campus certainly is aware of it and are doing things to promote AI and also ensure that it's not causing any issues. So an AI task force was actually created in February of last year. We've held events such as the Artificial Intelligence Symposium just this last February. Recently, the Fred Hutch just deployed a new AI technology to help analyze colonoscopies, in which they put when this is real time, hooks up to your colonoscopy, and it puts green boxes around things that it thinks are polyps, and it may be helpful in detecting flatter polyps, harder to see. We've invented technology at UW in which wearable cameras help detect medication errors. In this specific project, the AI was able to detect 99% sensitivity and 98% specificity, and when you're swapping medications and vials and syringes in terms of errors, if there are any. I think these are a couple of things that I think will be coming to all the providers maybe in the near future. These are three big projects being piloted right now. There's the Abridge Ambient AI Scribes, which started this February, which is part of the AI chat scribe that I was talking about earlier. And so far, it seems to have good feedback. We're coming up with a UW Medicine chat app like GPT, but it is in a more secure, approved environment. And then also there's a new AI technology, evidently AI-based chart surfing, in which AI will pull data from Care Everywhere, Epic, and other sources to give you a more succinct summary so it can help make chart review faster and more efficient. So these are a lot of the things that's happening at the University of Washington. Across my studies, I found something that Fresenius was doing, in which they used AI to predict and help guide physicians on ESA dosing and for people with anemia on dialysis. Basically, AI would generate a recommendation to you based on their iron levels, hemoglobin, and trends. And as you can see here on the results in the red boxes, physicians that used the tool and accepted the suggestions hit hemoglobin goals at higher rates and also managed to use less darbepoetin compared to physicians that didn't. So these are kind of the tools that's being developed and out there. But and just other future ideas that I had is I think if we could have ask AI questions in terms of chart review, like if I could ask it to list a bunch of nephrotoxic meds and give me a creatinine trend, which would help chart reviewing and things like that. Other recommendations for dialysis tax just to automate things better. And also, I haven't seen much about using AI to help create patient education resources, which I think could be helpful as well. So beyond tools, kind of what research is happening. And a lot of AI is being utilized for diagnostics because AI can analyze large amounts of data and identify disease patterns much easier than a human can. And that's where a lot of focus has been on. This is just a picture kind of demonstrating areas of research that people are working on. And I want to talk about a couple of studies that I found. I'm not going to go super in depth about any of these studies. They're mostly to just demonstrate what things have been done. In this study done in 2019, AI was used to analyze ultrasound imaging. And based on the ultrasound imaging, it would predict if patient had CKD or not. It was studied on about 4,500 kidney ultrasound images, and overall, AI could detect GFR of less than 60 about 86% of the time. Similar results for GFR less than 45. It did better compared to trained nephrologists who could only identify it about 60 to 80% of the time. But I also know we nephrologists are not radiologists, so I think this study was a bit unfair. Other studies, there was a big study done through the Department of Veteran Affairs in which AI analyzed a large amount of patient data and helped predict if patients would have AKIs when they were inpatient. So this is a busy slide, but there was over 700,000 healthcare records being analyzed. The AI created a type of neural network and then basically split data into 6-hour chunks and sort of kept that as a brain that it would use. And when someone was inpatient, it would use these data new entry points to decide if somebody would develop an AKI or not. Wasn't the most accurate. Only 56% of inpatient AKIs are predicted with about 48-hour window in advance, with the caveat being there was a rate of 2 false negatives to every true positive. So not the greatest, but I think what was useful from this study is that the AI predicted about 84% of the time if patient needed dialysis within 30 days of the AKI, and also about 90% of outpatient dialysis needs within 90 days of the AKI, which I thought was interesting. This is another study done evaluating AKIs in patients that had ICU admissions. So on day one, patients would come in, they would get a bunch of vital and lab parameters, and AI would predict their creatinine on days 2 and 3. And then it gave us an area under the curve of 0.73, which is pretty good. It's definitely not perfect, but it certainly at least gave us a clue of things. And outside of AKI, there is a research done that was trying to predict a risk of allograft failure and compared it to how well physicians predicted it. This thing was called iBox, in which 400 patients with kidney allografts were enrolled, and AI predicted at 8 years rate of allograft failure. Compared to 9 different physicians, 3 residents, 3 fellows, 3 attendings. You can see on the graph on the left, AI is the dark blue line, and it's the closest to the gray center line, which means it generally predicted things the most accurately. The N for the number of physicians was small, but you could see the line is a lot more, it's kind of all over the place, and the AI tended to do the best compared to others. It's also being done in areas like renal pathology. This was a study looking at AI and identifying different classes of lupus nephritis. Long story short, AI did a decent job at predicting or analyzing the imaging and predicting if they had class 2, 3, or 4 lupus nephritis. You could see on this graph here, or this chart here, 75% accuracy for class 2, 81 for class 3, 100 for class 4 out of about 150 total. So not perfect, but certainly things that people are working on. So AI seems great, but what are the issues with AI? And there certainly are a lot of issues with it, from anywhere from the lack of openness and to other safety and regulatory issues in regards to it. I think AI can be very difficult to understand and can create a black box effect. We often don't understand how it arrived at an answer it did. We give it an input, gives us an output, and we're not sure what the process in the middle is. It often creates and can hallucinate information and cite fake, false information as well. So I think we have to be very vigilant about using it to ensure the information is accurate. Interesting enough, the CEO of OpenAI essentially admitted he's not 100% sure how it works either. Other issues is the data used to train the AI has to be handled carefully. It's sensitive patient information often. The biggest thing is if biased data is used, AI will perpetuate the bias in its answers, and which can cause harm. There's medical and legal issues related to AI, specifically in that if there's fault with the answers, who is at blame? Is it the physician that used it, or is it the people that programmed it? There's a lot of ethical and cost issues associated with AI as well. In terms of cost, it can be very expensive, the computational units used, integrations into electronic health records, the environmental cost of AI in terms of the energy used, as well as the waste when it comes to production of AI can be issues as well. And so overall, I think AI certainly has its challenges before we can carefully integrate it into our electronic medical record systems. I think another important thing is how do patients feel about AI in healthcare? Generally, the studies have been pretty mixed on how patients feel. This was a study that was done measuring how people felt about AI in healthcare in general. You can see here in this study, overall in the next 5 years, they asked participants in the 5 years, do they think AI will make healthcare in the United States better? So this study was in, I believe, 2020. So sentiments may have changed a lot. But you could see 10% of people think you'll make it much better. 44.5% think it will be somewhat better. So at least half the people think AI will make a positive change. However, if you look at the more nitty-gritty details of it, patients are a lot comfortable, if you see on the top, with AI reading your chest X-ray, in which at least half the people are somewhat comfortable to very comfortable, versus if you go down to making the diagnosis of cancer or telling you have cancer, people are a lot more hesitant. People are very worried that AI will make the wrong diagnosis. And the other thing is they're worried about confidentiality. So I think this kind of tells us that the general public's opinion is a bit divided on how they feel about AI as well, and they're worried about its reliability as well. So kind of talked about a lot of different things here, but just to summarize all the things we talked about, AI is a technology designed to complete tasks like a human autonomously. There's many tools being used and some more in development as well. And there are a couple that maybe we can look forward to at the University of Washington. The AI research right now focuses a lot on prediction and identifying trends. And there's a lot of different issues surrounding implementation of AI, and we need to be very vigilant about how it's used. And patients tend to have a mixed feeling about AI in healthcare right now. I want to give acknowledgements to everyone that's helped me work on this project. And I also want to thank Dr. Laura Maeda for helping me prepare and organize the slides as well. And I think that leaves about 5 minutes for questions.
All right, thank you so much, Bang. That was a wonderful overview. Truly a brave new world we live in now. So with that, we have some time for questions if anybody has any. Yeah, sure. Go ahead, Catherine.
It's maybe more of a comment, just because at Polyclinic, we had rolled out the AI note generation, which I think is definitely going to come. And the thing that I thought was so interesting is that it's a real opportunity to change some of the like language bias that we use in notes. When I got my AI generated note, it said all kinds of things like patient non-compliant with this, because it's machine learning, having used tons of data from sort of how notes have historically been written, but you can teach it. So I was very disturbed by that, by just the language. It's language I would never use. But you just teach it and it stops using it, and it uses inclusive language, it uses patient-centered language. Like there's a huge opportunity to, I think, change a lot of the bias that ends up in people's charts. But it's a lot of work to do it. And I think I think someone like yourself or people who are interested in the AI world sit in those spaces to advocate for how language gets used within it is super important. So I am not a computer person or an AI person, and I'm sort of going to be drug along. I'm trying to embrace it because I think it's coming, but I love Bang that's something that you're interested in.
Any other questions or comments?
Bang, I have a question. Oh, sorry. This is Laura. I just had a quick question, Bang, as you were researching this, I was wondering your thoughts on what the impact of patients having access to AI. You talked about things that physicians are doing for patients, but what about like the impact of patients having AI on their care? And if you have thoughts on that.
Yeah, I certainly do. As I also notice, my younger generation of patients that I see in clinic often have better questions. And I do wonder if it's them using AI to or they've already asked some questions. I think it makes it so sometimes it makes me a little more nervous because they'll ask things that it is a lot more that I haven't thought about that AI may have prompted them to ask. So that's something I worry about. I think working with them to try to address whatever questions and concerns they have through AI, and also when we don't know, maybe trying to learn things together.
Bang, this is Dr. Bach, and I have a question. Right before your presentation, Bill Gates coming out with a comment about many physicians being replaced by AI in 10 years, and that's going to be during your career and many of the fellows. So I'm wondering, do you think that's possible? And do you think that a certain subset of physicians that it's really possible to replace them by AI, or can you think of reasons that there's no way that's going to happen?
There are a lot of things that I don't think AI can replace, like the personal touch of having a physician. And that's, I think, one of the bigger concerns patients have when you look at the surveys. I can't comment on how big corporations will feel about that, unfortunately. I do think AI in its current stage is not able to replace physicians, just in that it patients, I don't think, at least the general public, don't have that sentiment yet. I think it's difficult to predict what will be like in the next 10, 20, 30 years, and it's something that we need to work on. I think tools to aid physician and efficiency is good, but replacing them outright is not the best idea.
Thank you.
Yeah.
All right. Go ahead, Johan. You have your hand raised.
So thank you so much for a great talk, Bang. I think my question is, right now I feel a little bit like how the patients feel when they have Google and they have all these search engines and they search things and they're not sure how accurate, how well these information they get is. I feel a little bit like that about AI. There's OpenAI, there's ChatGPT, there's Copilot. Like, what are the things that, whether as a physician or as a user, we should be looking out for in terms of, what is a good AI? What is good AI?
Yeah.
What is efficient?
Right. You see that's where I made the comment, like the diagnostic stuff, where they're pulling the information. I tend to warn patients, like, I don't know where they're pulling this information from. It's all over the internet. How accurate it is, I cannot assess. So I always give them preface to that when they're asking me specific questions related to answers they may have gotten. And I can only really tell them what I know. I don't think there is some of the AI is getting better at detecting information and synthesizing information. So I think I don't have a perfect strategy for how I deal with them, but I tend to at least tell them, like, I don't know where the sources are and I can't for sure tell you if this is accurate or not.
Bang, another question. You mentioned the open evidence tool, AI tool, and the recent agreement between Open Evidence and the New England Journal of Medicine. Did you come across any other kind of agreements in place with major AI tools like ChatGPT or and other
There's
medical groups? Sorry.
I mean, not in terms of like search engine things. I mean, like UW, we are sort of working on our own, our bot as well, but I'm not sure about like other big research, other groups like that. I didn't find anything obvious, but I didn't specifically look too much into that either.
Thank you. All right, and get some comments in the chat from Gal Yuan. She does not think AI is better than us, and we don't have to worry about being replaced, at least anytime soon, I hope. And another comment from Catherine. Thanks. I have no doubt I'll end up coming to you with my AI questions, Ben. You're going to be our resident AI expert in nephrology. All right, well, we have about another minute left. Any other questions or comments? Really a fantastic overview, Bang. All right. Well, thank you. So I think this is a fast-growing field. I guess if I had to ask you one other question, Bang, sorry to kind of hold you up here, but you mentioned you don't have the, tough to predict how things will be in the next 5, 10, 15, 20 years. It seems to be moving rather rapidly. And as you mentioned earlier, I think to many of us, it feels like it's a pretty new thing just because of, and I think a lot of it has to do with the pace things have advanced. When do you foresee this being a routine thing in the use of healthcare, such as, something like UpToDate or?
Yeah, I think, the next couple of years will be very telling. It's also like how in medicine, our field in general is slower to accept things. AI is actually being used a lot more broadly in different fields. I went and talked with some people implementing AI for this project, and they kind of gave me their perspective as well. I think it's a little more in our field, as the stakes are higher. We have human patients we are working with, so we don't want to botch anything up. But I think the next couple of years will be telling. Just the fact that we're already piloting 3 different projects. Fred Hutch is using AI technology in their colonoscopy is like, will tell us like how things are going to evolve.
All right. All right. Well, thank you again, and lots of glowing praise in the chat there for a wonderful presentation. Just lastly, one other comment from Lily. I think the scope of our job will change a lot with AI. Eventually, physicians will be doing less diagnosis and coming up with treatment plans, but being liaisons between AI and patients. So we shall see. Very good. Well, with that, I think we should move on to our next speaker.